relieving on many levels, psychologically, chemistry level, detoxify oneself. So we move towards a situation of a lot of healing ability. This is a tooth in the lower jaw. It's number 6 in the left side. I'll just like to tell you one practical story from the clinic, and I will have a few of them along the road here. But one day, during our clinical day, one of my clients, I have seen him, he's about 40. He was sitting in the waiting room and I was busy, and my clinical assistant went out to him and saw him sitting like that with his hands sobbing. He was in deep pain, and he told her that he just came back from a travel with his wife. Okay, so I finished my client and he came in, and he was sitting there and said, well, I will take, it was really painful, and it was with pressures on the tooth, it was bad. It was really bad, a lot of pain. So I took an x-ray 5 minutes later. No problem as such. No swelling at the tip of the root, indicating a bacteria or inflammation in the pulp. So I said, well, now you're here. You can expect that we can talk about things. So what has happened to you? And then his tears went like this. He told us, that he just came back from a travel with his pregnant wife. They were going to be married the following weekend, and in northern Germany, they were exposed to a car crash. And he was in deep shock. And this is possibly the day or two after this took place. And telling me that, and me pointing out to him that that particular tooth relate to the colon, left side, and the rest of the colon, and the anus, all the way down there, and this part of the shoulder, elbow, lower back, lower neck. And while speaking to him, that also the colon can be the way where the place where we store emotional patterns, shock and others, other experiences. Suddenly he cleared up in his eyes. And 10 or 15 minutes in the chair, and about 20 minutes all in all, after his entrance to the clinic, he went away. No pain, happy, and having integrated his experience. So what I would like to use this example for is, this guy would possibly have an opening to a root canal in many dentist offices right away because of the pain level. No discussion. So another dead tooth following a traumatic experience in a car crash, being solved by acknowledging what had happened, the amount of pressure towards the marriage, the wedding, the woman being, or his lover, what is that, kæreste, being pregnant, all that pressure in one toothache. And it just lived in 15 minutes. So a window to the whole person on many levels. And as you see, we have the pulp with the nerves and the arteries and veins. And we have the denture, or the dentin, with all these tubular system, and then you have an enamel on top. So it's a living entity, and fluid is moving both ways. Dentists will know when they prepare a tooth, they drill into the dentine, and there's a sign of liquid. They have to dry the surface to go on with their procedures. So sometimes there's a fluid movement from the inside out, and other times, particularly when there's a low pH, acid pH in the mouth, there is an intake from out with the fluid through the enamel layer and through the tubular system to the pulp. And if that, say, pH level 2 or 3 is a reality in the mouth for maybe years. You can imagine that this low acid-like intake of fluid system will stress the pulp over time, creating inflammation. So to balance out one's saliva pH would be quite appropriate in many aspects. Clients having amalgam fillings for many years, they have often a very low pH, maybe 4, the normal is 7. And the bacteria in a mouth with a pH of 3 to 4, 4.5 would be quite aggressive bacteria, creating cavities and periodontal disease and gingivitis. So consider your intake of sugar, of course, and maybe you could also have some buffer from sodium bicarbonate, natron på dansk. So you balance cellular acid accumulation in your body. And then the chart. This is an English version, and it's without a lot of details, but it's a basic chart used by more and more holistic or biological practicing dentists around the world in the Western countries. I have met many at this point. And the chart is based on the work of Fritz Kramer and Rainer Voll. Voll was a leading German doctor, and Fritz Kramer, a pioneer in biological dentistry. And they used about 12,000 Germans, their patients, over about 8 to 10 years, and used electrical acupuncture, giving impulses at the area of the tooth and listening to how the body reacted. And having information from the hospital and x-rays, they came up with this chart about 10 years later. And we're talking about, say, mid-60s, end of 60s. I followed this man's work with his informational letter focus from early 80s, and in 85 we were a number of dentists who wanted to join and create a little society, and it became Society of Alternative Odontology, Selskab for Alternativ Odontologi. So we were about 25 or 30 at that point, and attracted people from Europe that we would like to learn from, and that was the start of activities like that. And the high sensitivity of the teeth and the gums and the tongue is mirrored by the representation on the gray matter. So you can see that the teeth, the tongue, and lower face as such takes a lot of place on the gray matter, both as a sensoric and motoric. So both ways nervous system is highly represented on the gray matter. In other words, the number of nerve endings per square millimeter in the mouth is the highest in the body. Maybe the thumb is quite close, as you can see. So the importance of the hand, and particularly the thumb, is quite high as well. This is one of my main pioneer inspirators. His book, It's All in Your Head, is the quintessence of his work after 25 years in amalgam-free dentistry. He would claim on his conferences, it's not all over the body or in the mind, it's in your head, it's all in your head. You have to look here. So he learned us a lot. We were a number of Danish dentists going to Colorado Springs in the state of Colorado, the years 88 and 89. And I invited him to Denmark in 89, in the fall. And we created a lovely weekend on Tidens High School with dentists and doctors and different professionals. And he's one of the leading pioneers in this field. And here at his own clinic, in his meeting room, his sword, the dragon slayer, as he mentioned. So he was quite a target for a lot of stress in the American Dental Association. Dentists attending his conferences wouldn't get the points that they normally obtain from going to a conference. His wife and children were threatened on the phone. His $1 million microscope was stolen from the lab. At this particular clinic in Colorado Springs, he employed 55 persons on the lab, different functions, testing, therapeutic aspects. His wife was Eastern-inspired, different Eastern relaxation techniques. So I would say there was a huge inspiration to go there and see the setup. And people would fly in from Canada all over US with their loved ones, often living in a hotel situation for maybe 3, 4, 5 weeks. And on a safe condition, having their amalgams removed, having blood test running, a nutritional plan, supplements, all that in a package, and all of it videoed. So when they came back to the rest of the family and neighbors, they could see, this is what I experienced. I am in a much better situation now. This is a man. If you want, you can go there. It costs such and such. And Hal Huggins. Yeah, sorry about that. At that particular conference, he also mentioned the work of Weston Price, one of our leading dentists ever, doing research together with doctors and other researchers in the 30s, traveled all over the world to find out the consequences of the introduction of white flour and white sugar on original people, measuring their bones, the facial looks and so forth. And from having rounded spherical faces, they would deform after a few years on white sugar and white flour. And that's all in the book. This kind of material where he actually extracted the toxins from root canals and put them under the skin of rabbits, so the rabbit would die of the same disease that the bearer of the toxins, the person. All that is described in his research programs. A clear brain, a lovely person, and Hal Huggins had integrated him in his nutritional education himself, Hal Huggins. And it was such a breakthrough for seeing the opportunities, just to jump from just being a no mercury dentist to a more conscious one, having a lot of instruments in your box to play with, was enormous and very, very valuable. At that conference, I will just mention that that was a MD, a doctor, having researched on the dentist as a profession, and he gave a paper showing that when you have doctors, dentists, lawyers, engineers presented for psychosomatic testing procedures, the dentistry came way back. Even testing on the telephone, a seven-digit number, they had to go back, and even the manual, the motoric action would be quite unsure. So we have a profession here, highly influenced on the pituitary and the pineal gland, being at the mercy of the professors of his or her profession, having no chance to make he or her own discernment. The faculty has gone, or almost gone. So then they are just giving on to their clients, patients, what they were taught at the high school, at the dental high school. No dogma realization or leaving behind the traditional or the belief systems of conventional dentistry. And he also told that in terms of statistics, the dentists were way up there in divorce rate, suicidal rate, depression, all these classical high symptoms of a mercury toxified person. And in terms of insurance affairs, they pay